By now, you recognize the face and know the voice.
Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer.
Of the person leading a province through a pandemic.
So there's a couple of updates we have this afternoon.
Dr. Bonnie Henry has gone from public health officer to public hero for many in a matter of weeks. Her calm demeanor sometimes masking the power that comes with her words, delivering a message that's resonated in ways she never imagined. She's become an artist's muse. People have painted murals of her, others have sung songs about her.
You will lead us through self-isolation.
The fanfare enough to trigger a blush from a public figure who shies away from public attention.
It feels a little bit unreal, and it's very humbling, and it is, it's not something I'm used to in any way.
Yet all signs point to an underlying passion that's been there since she was a girl.
I remember the day when I was in high school when I thought, you know what, I need to be a doctor. But I didn't know what kind of medicine I wanted to practice when I was going through medical school, and I spent some time in the Canadian military.
And shortly after, she discovered the field of epidemiology, or as she saw it, a career as an infectious disease detective.
It just really struck me as exciting. It's like the Sherlock Holmes of the medical world, and So I fell into that relatively early on, and it was an epiphany for me.
Meanwhile, her sister Lynn recalls a specific story that started it all.
When we were both still in elementary school, I was taken to the hospital to have my appendix out, and I think that was her first experience of going into the hospital, and in that moment she realized this is what I want to do.
Lynn lives in Toronto and had traveled to Victoria to visit Bonnie over March break. As life began to lock down, she knew she needed to stay to be a support to her sister.
Bonnie did say to me, okay, the one thing you have to know is that I will basically be able to think about and talk about nothing except this virus. So you just have to imagine that I have, a sign on my forehead that says COVID-19.
Late yesterday, we had our first case of a novel coronavirus.
An all-consuming job, a lifestyle. And for Dr. Henry, there was one day that everything changed.
I think of March 12th as sort of the day we learned a lot about what was going on globally. It really was almost like opening a curtain and the light shining in on a variety of different things.
Suddenly, a virtual shutdown of society to protect the population, a monumental task, one that drew on past experience to help. 20 years ago, Henry traveled to Pakistan, where she worked with the WHO on a polio eradication program. A year later, she went to Africa to help battle the Ebola outbreak in Uganda, lessons that would arm her for later.
Having those international connections really helps you understand some of the sort of backstory of what's happening in different countries, and that's been, I think, very helpful for us.
Then in 2003, Henry was in Toronto helping to lead the charge against SARS. It was an experience that taught her the importance of sensitivities around privacy.
I talked to every single one of the families who had people who died from SARS, and I knew the impact that the disease had on them. That really drove some of the reasons why I've been so passionate about protecting people's privacy, about ensuring that we do everything we can for healthcare workers. It's things like that stay with you over time.
A lengthy resume that later led her to British Columbia. It was 2018 when Henry took over as provincial health officer.
It was probably the easiest thing I've done as Minister of Health to be able to sign that order and introduce Dr. Henry at the press conference, but she was the obvious choice.
BC Health Minister Adrian Dix is the one who stands next to her day after day, briefing after briefing, co-managing a crisis together.
She has, I think, the capacity to explain complicated issues in a way that both attracts people and people want to listen to, but also that they can understand. I think what I'd like people to know is every single person matters to Dr. Henry, and I get that sense every single day.
Yes, every person does matter, she says, and that's what keeps her up at night. But day to day, the only way is to focus on the good.
Every day when I walk home and I watch people and lining up to the grocery store, and most people are patient and they're working it through and they're working it out, and that's what allows me to sleep.
Tanya Fletcher, CBC News, Vancouver.